Hi everyone, it's Emily, your doula here at June, and today we're going to be talking about safe sleep. This is a really important topic, and we're going to go over a few really important tips and guidelines to make sure that your little one is sleeping as safely as possible. When we talk about safe sleep, we use the framework of the ABCs of sleep that are set out by the American Academy of Pediatrics, or the AAP. These simple guidelines can really help to make a difference in preventing SIDS and making sure that your little one is tucked in safe and sound. So let's start with A, alone. Your baby should be sleeping alone in their own sleep space in a nice, cool room. The AAP suggests sharing a room with your baby for at least the first 6 months and ideally up to the first year of life. That provides some really nice reassurance, having your baby close by in the middle of the night, but also is shown to reduce the risk of SIDS by up to 50%. So sharing a room with your baby in those first months is really important. However, sharing a bed or a sleeping space with your baby is not recommended. Let's move on to B, back. You want to place baby to sleep on their back every time you put them down to sleep. Even if they are old enough to roll over and get themselves onto their sides or onto their bellies, you always want to be placing them on their back when you set them down. Once they're old enough to roll on their own, it's okay to leave them in whatever position they end up in, but as a rule of thumb, always put them down on their back. Let's talk about C, crib. You want to make sure that your baby's crib or bassinet is completely clear of everything except for a few key things. The only things in your baby's sleep space should be a closely fitted sheet, possibly a pacifier if you are choosing to use one, and your baby. Your baby can be either swaddled snugly or in a sleep sack, but no loose blankets, no crib bumpers, pillows, loveys, books, toys. Everything like that needs to be out of the crib until your baby is at least a year old. That is the way to set up for a safe sleep. Here is a baby practicing safe sleep in a CPSC approved bassinet, alone, on their back, and swaddled snugly, no loose fitting anything in the crib, no pillows, bumpers, loveys, anything like that. The only thing that we could potentially add to this sleep space would be a pacifier if we are using one. When choosing a crib or a bassinet, you want to make sure that you are looking for the CPSC approved spaces. These are going to be following the strictest guidelines for safety and approval for safe sleep. Generally, anything marketed as a crib, a bassinet, a travel crib, or a pack and play is going to be approved for safe sleep. Those firm, flat sleep surfaces. You're going to want to avoid any products that are marketed as a napper, a lounger, a sleeper. Anything like that is not approved for safe sleep, even if you see ads showing babies sleeping in them and hearing about other parents using them. It's your decision ultimately where you choose to put your baby to sleep, but we want to make sure that you're well informed and have all of the information you need to make a decision that feels right for you. So one of the questions that I get most frequently from new families is, how long can we keep swaddling this baby? Generally, they're worried about that transition out of the swaddle and how it's going to affect everybody's sleep in the house. The rule of thumb is whenever your baby is starting to show signs of rolling from back to front, that is when it is time to transition out of the swaddle. The AAP suggests that this is at 8 weeks old because some babies will show signs of rolling that early. I would say many families that I work with tend to transition sometime between 8 and 12 weeks, depending on their individual baby. Oftentimes, newborns can seem to have what seems like superhuman strength when it comes to those early days and swaddling. So it's not uncommon to see your brand new baby in those first few weeks of life be able to get from their back over to the side by kind of flailing their legs. That is normal. It is a reflex that will go away within the first few weeks of life. It does not mean that your baby's going to roll super early and that you need to stop swaddling. It's a question that I get a lot from parents, and I like to put their minds at ease that it's a normal reflex and it will pass. Thank you so much for joining me today to chat about safe sleep. Please don't hesitate to reach out to us at June if you have any questions about sleep for your newborns.